Now we go to the microscopic revolution, where we'll start by talking about germ theory. Louis Pasteur disproved spontaneous generation and proved that microbes cause fermentation. Robert Koch identified TB, cholera, and developed Koch's postulates. And John Lester brought antisepsis into surgery. So, why this change everything? Diseases now had identifiable agents and diagnosis became specific, not vague. Treatments could be targeted and not philosophical. This was the first time when doctors could say the disease that you have is caused by that organism. We're going to talk a little bit more about Louis Pasteur. He was a wonderful, wonderful person. You can see him on the right side of the screen. He came up with the germ theory, which is the foundation of modern medicine. He showed that microbes cause fermentation, spoilage, and could cause disease. He came up with pasteurization, which is heating substances to kill microbes, which revolutionized food safety. And he came up with one of the earliest scientifically developed vaccines, which included vaccines for rabies, anthrax, chicken cholera. What is that? I'm sorry. He introduced attenuated vaccines, proving immunity could be engineered. And next, the person that we have here is Robert Koch. He identified the exact organism behind major diseases, for example, Bacillus anthrax, which causes anthrax, Microbacterium tuberculosis, which leads to TB, and the discovery of which led to the birth of modern modern bacteriology, which led to him winning the Nobel Prize in 1905. And he also discovered Vibrio cholera causes cholera. He developed pure culture techniques where he invented the following, which include agar plates, streaking methods, isolated colonies, and solid media growth. He also invented different staining methods, including the TB stain, which you can see in here, which is beautifully. No, I'm sorry. It's a different. The image here is about anthrax. I'm sorry, guys, but he did invent staining methods, including the TB stain using methylene blue and later Ziegler-Nielsen variants, which made bacteria visible. He also had this huge contribution called the Koch's postulates, which were the gold standard of causation. Here, the idea was that microbes are found in every case. They are isolated in pure culture. They cause same disease when introduced into a host and re-isolated from the experimental host. If they fulfill all of these criteria, then they are an individual organism, specific organism. Now, we'll talk about how diseases start in cells. Virchow and cellular pathology. So here is one of the images from R. Virchow's lecture called Cellular Pathology from 1860s. Rudolf Virchow shifted thinking from whole organs to microscopic units. His idea was omnis cellula e cellula, which means all cells arise from other cells. That is, disease is a cell level injury, not bad humors or bad air. He connected pathology with clinical symptoms. He laid the foundation of modern reasoning, including inflammation, degeneration, neoplasia. He advocated for social medicine, arguing that poverty causes diseases. Now we get to the pathological era. This era revolutionized medicine, that disease was localized to tissues and cells. The major shifts in here were by Giovanni Morgani, who linked symptoms to post-mortem anatomy. Clinico-pathological correlation begins. Laennec, who invented stethoscope, and by his observations that clinical signs can be linked to internal lesions, and Rudolf saw that all diseases start in the cellular pathology. The impact, there was a shift from functional to structural reasoning, and bedside medicine plus autopsy correlation led to diagnostic precision. Now, we'll talk about the physiology and birth of systems thinking. This is where medicine stops being descriptive and becomes mechanistic. Here we have the following people to thank, including Claude Bernard, who came up with internal milieu, who came up with the idea of homeostasis, with Harvey, which we earlier talked about, who came up with circulation of blood in 1628, and Sherrington, who talked about reflex arcs and neurology, and then Pavlov, who gave us the concepts of physiological conditioning. In 1628, after 10 years of painstaking solitary research, Harvey at last published his discovery in a book known as Dermatocordus. His idea that blood is pumped around the body by the heart in a state of ceaseless motion proved highly controversial to some, challenging the 1500 years of established scientific and medical belief. His research revealed that the blood was not concocted in the liver but circulated from the heart. In doing so, he changed the conception of physiology and life itself forever. Here we have Mr. Harvey, and this is some of the diagrams demonstrating what he came up with. Talking about Claude Bernard, he talked about the constancy of the internal environment in a way that it is the condition for free and independent life. The mechanism that makes it possible is that which assured the maintenance with the internal environment of all the conditions necessary for the life of the elements. Then we have Mr. Pavlov. He looks very happy. He came up with the ideas of classical conditioning theory, and this is basically how you can condition an organism or a physiological pathway to behave in a certain way so that you get from point A to point B. Now, what changed from this? Organs were now understood through function, not superstition. Medicine moved from what you see to how systems behave. Diagnoses became integrated, like respiratory, cardiovascular, neuro, and endocrine.